there's increasing evidence that gender is a major determinator of treatment outcomes and tumor, and might even affect tumor biology. So for this reason, I think it's important that we learn more about this topic and raise the awareness. The aim of the meeting is to understand the concept of gender medicine and to look at the different at the topic from different perspectives, from pharmacology, look at different gender differences in outcomes in GI tumors, in melanoma, for example, which are very prominent in lymphoma. So the idea of the meeting is to raise the awareness of the topic, to learn more about it, and I hope that it will stimulate clinical investigators to better understand and design clinical trials.